thanks for having me here. I'll just kind of jump right in to the mind of a scientist. I'll be talking a little bit about my work in behavioral science and clinical psychology. And so I thought I always like to start off with a little levity. And you can see that the idea is to take my mind to your mind and my thoughts to your thoughts. So not really mind control, but I'll do my best to give you a sense of just what it's like to do the kind of work I do. And I think has been set up by the library in Milo with having different speakers is just wonderful because we get a little window into different possibilities for the future. And for all of you, that's a great thing. All right, so let me tell you a little bit about the field of psychology. Just those of you who are not familiar, to give you like kind of a general idea, from the functions of the brain to the actions of nations. So why do people behave the way they do? That's what fascinates me. And why don't they behave a different way? And why doesn't everyone respond the same way to the same stimuli, to the same childhoods, to the same, ads on the TV? And this looks at behavior from childhood development to care for the, elderly, to end of life, in every conceivable setting, from scientific research centers to mental health centers. So research institutes to providing clinical care. We're trying to understand behavior. That's what psychologists do. And the main organization for finding out about psychology and all of its disciplines is the American Psychological Association. So Milo asked me a little bit to talk about what inspired me to go into psychology. So what inspired me really to go into psychology was chasing these peak performances. So I would have good days, I'd just be excited and I'd play really well, and then I wouldn't necessarily be able to reproduce it the next day. And so I was really fascinated by how do people consistently do that and reach professional level. And that's really colored everything that I've done in my work. Ultimately, wanting to be able to create like on demand, not just hoping one day I did well, this optimal mental state, as we call it, psychophysiological state for practice and performance, which is what we call being in the zone. And even today, I'm amazed at how many people will spend years practicing, training for the Olympics physically, only just to hope that they go into the zone. And so what I did was I started looking at around, and this is how science works. People start looking around at, well, let's observe what's working. And so I started looking at these Eastern practices like Buddhism and yoga and Tai Chi and Aikido, some of martial arts. And I found that they would help me a little bit be more calm and focused when I was performing. And so I started reflecting on, well, what's working there. These arts generally don't have empirical science base. So I started looking at Western science and studying clinical psychology, reading books about health psychology, where they talked about how behavior influenced disease and being healthier in terms of behavior, and neuroscience, what's happening in the brain, and then sports psychology, where they're really trying to intervene in the lives of athletes to make them perform at their best. So for me, the three big questions in my research is how can behavior, such as sleeping and eating and exercise and breathing, promote health and prevent disease? Okay, so how can those behaviors lead us to have a healthier, longer, more satisfying life? And secondly, what motivates sustained health behavior change? What gets us to do the things that maybe we already know we want to do? I'm sure all of us this week have thought about something to do with a health behavior, exercising, eating healthier, getting enough sleep, meditating, but we're more or less successful at doing it. So I'm going to show you some research that I've done in each of these areas to give you an idea of what that's like. And then how can the mind be trained to produce these peak performances? And that's the sports psychology area. So I'll tell you a little bit about my work in a typical day, what I love about it. I'm a university professor, so at Sonoma State University, and I do research, and I saw some of the previous speakers who have come from universities. So you probably heard a little bit about this balancing act of doing research, teaching, and then community service. So coming out and talking to students like yourselves trying to give you some ideas that'll help you be more successful, help the community with whatever skills you have in academia. So if you're a biologist, like some of the speakers, will talk about the environment. So that's part of like educating. I'm also a licensed psychologist. So with the doctoral degree in psychology and clinical training, you can get licensed by the state to practice psychology, where your focus is more on treatment of psychological disorders. And then thirdly, in my day is consulting. So I work with corporations who are trying to create innovative solutions to meet the needs of their customers, whether it's for using technology, promoting health, or in the performance sports psychology area. So one of the examples was help a pharmaceutical company develop online behavioral support and interact with engineers, bench scientists, marketing people, and try to come up with a solution that will provide help to their clients. All right, so let me tell you just a little bit about my career journey. Have some pictures on here to illustrate some other things in a second. But as I mentioned, I'm originally from Australia. Till I was 16, most of my focus was on playing tennis and minimally on school. And then I came to the US on a tennis scholarship. I went to San Jose State. I put down here I have an AA degree, which isn't true there. That's the first 2 years of college, but it's in Division I tennis. So most of the focus was on that. And as I mentioned, I just started reading, getting excited about ways in which I could improve that. However, after a couple of years of college tennis, I transferred to St. Joseph's College, where I studied humanities and philosophy, and the philosophy of science specifically. And that gave me a really broad knowledge of the arts and humanities, as well as philosophy. And then I went to San Jose State, returned back, did a master's degree purely in research and statistics, where I collected data and learned how to kind of apply the scientific method. And then at the same time, I was a research coordinator at Stanford. I was paid full-time position to run clinical trials of behaviors related to healthy aging. So exercise, nutrition, sleep, and meditation during that time. And after that, I went to get a PhD at the University of Missouri in Columbia, where I studied research and clinical. I received training. Then I came back to California, to the Palo Alto Veterans Affairs Hospital in Palo Alto, where I did a clinical psychology internship, at the same time continuing in my research program. After I finished the PhD, which comes after doing both of these, the academic training and the clinical internship, I was a postdoctoral fellow at Stanford, where I almost exclusively focused on research. I was funded by the National Institute of Health, Epidemiology, and Biostatistics. So psychology then being more empirically grounded. And then I was hired at Sonoma State University as a tenured track professor and continued to teach and do research at Stanford. I have a few little things to point out here that I think are nice, both academically and in terms of life. You'll see that I come back to some of the same places. So I was I guess now, more than 20 years ago, was a research coordinator assistant at Stanford, built on that knowledge and actually came back about 8 years later as a postdoctoral fellow at Stanford, and then continued to be an adjunct clinical faculty at Stanford and then an instructor. So I want to encourage you, whatever you're learning, wherever you're learning it, you keep connections with those people and those institutions and ideas. So whether it's at your school with your teachers like Milo, you build on those throughout your career. And you might notice another pattern, that I was at San Jose State, which I came to by chance as a tennis player, returned back, built on that, and then ended up being a professor in the California State University system. So those things together. So let me talk a little bit about some examples of my research. And I'd like you to get a sense of just how broadly you can apply research skills. I would argue that if you get good skills in data analysis and experimental design, you can apply it to pretty much any field. Sometimes we spend a lot of emphasis just on how we do biological research, or we're counting cells in a lab, then we do physics somewhere else. All of the scientific method skills that you develop, you can apply to answering any question. Because what is science anyway? It's empirical reasoning, you would argue. So it's reasoning well. It's the philosophical side, the logical side, which traditionally was only thinking. And then we collected data, the quantitative side. So we're reasoning about data. And that skill will stay with you forever. It doesn't matter what happens with the economy, with technology in the future, with medicine, education. If you can do that, I would argue that you would be really useful to anybody in the future. And my focus just happens to be on behavior, which obviously is everywhere as well. So I'll mention just briefly about a couple of a study in each of these areas, just to give you a feel for what research is like in these areas. And then I'll give you a few tips to wrap up. So one study, as I mentioned here, health and behavior. So sleep and risk factors for falls in older adults. This was a study that I did with colleagues. And we asked 971 women, 555 men, 64 to 99 years old, who were randomly selected from the community. So this is kind of an expensive study because we randomly called hundreds of thousands of people. And it had to be randomly called, right? Because we can't have the selection bias, which would be, we just say, who wants to answer these questionnaires? Which is oftentimes what happens, in a political environment. If the studies are not done well, we get that people who only wanted to answer data. So randomly got them, they did 20-minute interviews. And just to give you kind of the punchline here, what we found in those interviews was that insufficient sleep was found to be a risk factor for falls after we controlled for all the other known factors. So this is how science moves forward. And one of your previous speakers, that biologist, was talking about being the first one to find out something, or his graduate students being the first one to find out something. And that's the idea here, is that then after we did this work and showed that even if you controlled statistically for people being low income, living alone, having medical illnesses like vision problems and hearing problems and brittle bones, osteoporosis, sleep was still a factor. So that became part now, is part of the assessment of older adults. And physicians are looking out for people reporting that their sleep is poor, because one of the biggest problems for older adults is that they can live independently, usually until they fall. And when they fall and they have an injury, they oftentimes lose their independence and need more assisted living. So that's just one study that looks at kind of in the health psychology area. The second one is kind of is looking a little bit more in kind of the clinical. So we had people in a long 2-year study, the first year of which we were looking at, could we influence their physical activity behavior? So we kind of know that it's good to do it, but is there a way that we can, in a cost-effective way, get them to exercise more? And so there were 43 women, 57 men, aged 50 to 65. They were randomized to monthly mail or phone. So now you can see the modern time of different types of apps that you could use. Which one will motivate the change better? That's an empirical question, right? So we randomized them those conditions and found that if they got monthly phone, and the phone, interestingly enough, was done by computer. So the phone, when they were called, wasn't a person. It was the computer calling and asking you, how much exercise have you done today? Push 1, 2, or 3. That was, how many minutes? And then would respond. And then actually I wrote a number of these algorithms. It took quite a few months. But if you didn't do it, you would press 1. And then I'd say, well, what got in your way? Here are 10 reasons. Then when they said number 2, I would give them a more solution. So it's a big tree of thinking, but that's getting the clinical thinking into an empirical form, right? That it could be administered by a computer. And we see more of that now with telemedicine and studies, but we do need to know whether it actually works as compared to doing face-to-face. So adherence to exercise for the male interventions, and the phone were both successful. So we know that we could kind of use those in addition to face-to-face. All right. The third area is this assessing mental strengths. And this is the sports psychology kind of domain of research that I'm involved in. So I was looking for creating a snapshot of the mental dimensions of an athlete. So could we assess what's going on in the mind of an athlete and relate it to their performance? And by doing so, be able to alter some of those variables and improve performance, right? I wanted to create a tool for exploring those and seeing if mental training then would change them such that the performance was better. So I'm going to tell you just briefly the process of this so you have an idea about another kind of research. And this is really assessment research. How do you design a measure that will capture the psychological behavioral factors that you're interested in? Okay, so reflect on my clinical experience was the first thing, and my colleagues. So we just said, look, with our experience working with athletes, I've worked with hundreds of athletes. Stanford teams, I've probably worked with 15 of those teams over the years, but it's just my personal experience. And one of the things we all need to keep in mind is that our personal experience is really not like most people's, right? We tend to be in our same kind of ethnic group, income level. We see the same kind of people unless we break out of some of that. So it's important for me not to just make a measure and decide it's good because it worked with the few people I was with. But we start there because all of us have to start with the experience we have. Then I discuss that with students, student athletes specifically in my Stanford and Sonoma State classes, reviewed the scientific literature on sports psychology. Who else has tried to measure things? What have they found? What was the validity? What was the reliability? And then I wrote 156 items to try to capture those things as well. Now, the study designed to see if it was valid and reliable. I asked 327 NC2A Division I, that's the high-level college athletes, and 100 Division II athletes from 20 sports. The Division I scholarships are all on full scholarships, so I kind of had a more elite group. I have an Olympic and professional group that I compare to, which I could tell you about another time. But at time one, we asked people to complete the mental strengths assessment. That's 156 items, and a number of other psychological measures on stress, adjustment, sleep, and I guess stress again. We gave it 1 week apart, so we could look and see if the result we got at time one was pretty much the same as time two, because we wouldn't expect their mental strengths to change in a week, and that would give us an indication of reliability. So I'm going to tell you a little bit about what we found, just kind of the take-home message. We found good validity. So what's validity? In science, validity means that you found something, you've measured it in a way that you know it's accurate. You're actually measuring what you think you are. And this is a big problem in psychology, because you can say, well, you know, I'm interested in depression, but it could be measured many different ways. It's kind of difficult to do that with things like light. Those are kind of more standard, but in psychology, you might have 3 different measures of the construct. So one of the ways is to just be able to discriminate between groups. And so that's what we looked at this stage, what I'm telling you about. As upper class, juniors and seniors scored better than lower class. Full scholarship students scored higher than partial scholarship students. That is, they got better results. And I'll buzz you through the questionnaire in a minute, and you'll see what the items are or what the scales are. And then finally, Division I scored better than Division II. So this gives us kind of a discriminant validity. We're starting to look at that. And then the reliability was good because, and if I could show you later, the correlations, athletes scored about the same at time 1 and time 2. And so it's really important to keep this concept in mind as you study science. You're asking, something could be reliable, that is, you get the same answer over and over, but it may not measure what you intend to measure. Or you may be measuring it well, but it changes at different times because of the way people feel when they answer the questions. Okay, so just give you a little feel for that kind of work that I do, which I find really interesting and challenging. So let me show you the measure. Oops. So now, I know Milo is going to afterwards ask you a little questions about some decision making. This measure is being used for with a number of teams for the last 10 years. NBA draft selection. So the National Basketball Association, they have a draft where they recruit their professional athletes to pay them a lot of money, and they really want to not make mistakes. And so they want to use all the information, all the data they can to recruit people who are going to be successful. And one of the things that some of the performance psychology consultants use when they're hired by these teams is this measure. And so what they do is they give the measure to the recruits, and then they try to give information on that to the general manager and the head coach. They can use that with their physical assessments, the speed, their shooting percentages, etc. And what the athlete does is they get their score, which you can see here, and they're compared to the elite sample that I've developed. So it's a nice way to explore some of these mental dimensions. If you're low on, say, commitment, then we can ask you questions about what's going on, that you're not so committed to your sport or you don't feel so competitive. So let me go briefly through the mental strengths dimensions, because I think they also track well with what helps people be successful. One of the nice things about my research is I can talk about the research, but it's also related to a lot of things that we like, which is how can I do better? How can I be happier, and how can I perform better? So drive is one dimension. Won't take the time to go through all the items. All of these scales. Each scale is about 4 or 5 questions that all clump together. But drive is, this little slogan: don't stop when you're tired, stop when you're done. So how driven is the athlete or the performer to do well? Attitude, weakness of attitude becomes weakness of character. So how optimistic are they? How confident? How much fear of failure and success do they have? So what's their attitude like when they're performing? Self-regulation. Can they create optimal energy when they need it? Do they have negative thinking, pre-competition anxiety? Can they control their emotions? Can they relax when they're too tense? And then can they get energized when they're not motivated enough? Can they recover from errors and setbacks? How well do they handle pressure? And the last 2 dimensions, so we call these dimensions because they're made up of these scales, and within these scales there are items, there are questions. So how deeply you can focus, how long you can maintain it. Do you stay temporally in the present, or do you keep switching into the past and the future? How much distraction do you experience from the outside world or from your own thinking? And then finally, use of mental skills. Do you use positive self-talk, imagery to enhance your performance, to keep you doing your goal setting? Do you have social support? Are you relaxed? Are you able to you practice relaxing? I always argue that, getting more relaxed is actually a hard thing. You have to practice it like you would practice jumping rope. Do you have a routine that prepares you for the exams you take, before the events you perform? And can you let go under pressure? And I like this little saying here that you should sit in meditation for 20 minutes a day. Unless you're too busy, then you should sit for an hour. So we want to find, and that's just the life skill, you to develop ways that you can control your responses to stress, struggle, pressure. And if you can, it's the old saying, if you don't mind, it doesn't matter. That's the mind over matter, right? So let me just tell you, to wrap up, a few suggestions about what I think, is involved in finding success in school, college, and life. And you can see from these little images here, being flexible is probably the key factor in psychology now that we've found is related to mental health and success. And that is that you can do different things in response to changing environments. And even physiologically, as people do more meditation, as they become more flexible, you see that their cardiovascular system even does the same thing. Their heart rate goes up and down in response. When people get stuck, they get rigid, they can't respond to different people in different situations and changing. So practicing putting yourself in situations that are not comfortable, that you have to kind of stretch to and accept, I think is really pivotal. Reading, writing, and thinking. Obviously, in school, you want to read as broadly as you can. Write. I mean, in academia, we have a saying, don't write anything you can't publish. But I think what that means is write things thinking that you're going to share with people. You're going to help people with your writing, whether that's your classmates, which I know in your school does a nice job in the writing classes of sharing writing, and then thinking, just taking time to do that. Aristotle, a famous philosopher, said you need leisure for academia. You need time to just let things move around in your mind. The best predictor that you'll win a Nobel Prize, by the way, according to one of my colleagues at Berkeley who studied Nobel Prize winners, was not how intelligent you were, and not necessarily even as hard you worked, but if you showed up and you would see things, if you just keep thinking about them, ideas come to you. So kind of have that idea. Embrace diversity. So be exposed to as many people from as many backgrounds, and not just in terms of, ethnic, cultural orientation, ideas, but in science, talking with different people from different backgrounds. Most solutions that we need to have in science will come from multiple disciplines. Down on the left here is math. Study math. Everybody should study math, like they should brush their teeth, right? And you might say, well, I'm in psychology. So in psychology, talking to people. Yes, it is talking to people, but it will limit your future because the language of science is mathematics. And it doesn't mean you need to be, a mathematician, but having a good facility with data and quantitative thinking. And then doing art. So I have the do art here. So art helps you with thinking about the world in a different way, just like science does. It has you see with a different lens things. And then finding a need and filling it. I probably think that's the thing I tell the college students the most. You don't look for a profession or where to fit in or a niche. Think about where are their needs in the world. It could be the need to get to San Francisco on the freeway with less traffic. It could be how to make our watershed more sustainable, or it could be how to reduce poverty or homelessness. But when there's a need and you figure out, you just keep asking yourself, how is everyone trying to fill this need in the world? Organizations, nonprofits that are doing things, and research, and then say, well, this is an area I'd like to contribute. People will pay you to do that. People have needs, and that I think is probably one of the best pieces of advice I got, was find what people need and figure out solutions for them, and then that will go a long way. And then the last thing, just to wrap up, is a little Zen story that some of you may have heard, but it's about a university professor, so I can tell on myself, goes to see a wise Zen teacher, and they're sitting out in his little outside room near a lake, and he's pouring the professor some tea, and the professor says, hey, what can I learn? What do I need to do to understand this Zen thing? And he's pouring the cup of tea, and the professor's getting anxious because the tea cup's getting more and more filled, and eventually the teacup overflows with hot tea. And the professor is like, what are you doing? What are you doing? And the master said, you are like this cup of tea. You're full of your ideas and opinions. You need to empty your cup so that you can learn something new. And that's what I think we need to do with science, is just continuing to ask the question, well, how are my prejudices? How is my previous work getting in the way, and be able to move forward? And the resources for you to look at, the American Psychological Association and the Association for Psychological Science. You could spend all of your time looking through those organizations, the website, and you would learn so much about psychology as a science. And finally, Science Daily, I read every day. It's about new news from the journals for across science. So reading about things that happen all over the scientific community, I think, is important. And I will stop there. I was trying to watch the time, but I...
Thank you so much. It was such a fascinating presentation. And students, I've put our discussion scenario in the chat. Stefan asks, does the zone share any similarity to the flow state?
Yeah, so that's a great question. They're used pretty much similar. I guess at the same time, pretty much, we will talk about them the same. Yeah. So you can kind of substitute the one for the other in terms of that.
Mm-hmm. Sophia asks, how many independent variables do you usually test at a time? I noticed in your mental health assessment that you had 3 independent variables and 1 dependent variable. I usually have 1 independent and 1 dependent variable when I do experiments
Yeah.
in class.
So it just depends on how complex you want to go. The more simple with 1 independent variable, it's much easier to interpret, right? Because you've got 1 variable related to another variable. Once you start stacking the independent variables, it gets more difficult. So in a true experiment, it's in psychology, we've been accused of using too few independent variables to try to be really rigorous. But unfortunately, there are many variables that drive each behavior. So the more we can include, the better. So yeah, and for practice, I mean, you can have different levels of your independent variable. So you can first start by just maybe having, a control group and a non-control group, and then you can add a control group, 2 different kinds of control group. We have weighting control groups, and we have intervention, groups that get different interventions. So yeah, I think you can kind of go from the 1 variable and then expand as you can.
Carrie asks, how do you approach neurodiversity in your practice? Have you learned anything from people on the spectrum or people with intellectual disabilities that you didn't use before?
Yeah, so I probably don't have as much experience doing that work. The limited experience I have, I think, is that we're finding that people have different abilities. And that what we want to do in psychology, again, psychology was a little bit accused of focusing on treatment of pathology. And now I think we're starting to, well, I've been like that since I was an athlete, because it was always about doing better and enhancing, not treating sickness, is to see that people have different skills, and we want to find those strengths and have people use them. So if somebody is really good at narrowing their attention on one task, then we need people on a team who can do that. We also need people on a team who can do 4 things at one time, and people that are more social. And so I think that's what I've seen now as psychology is much more optimistic and positive about the need for different kinds of people with different abilities working together. Great question.
Gwen asks, how do you think the pandemic/distance has affected mental health?
Yeah, I think the data is relatively clear that it's had a negative effect on people overall. One of the hard things about science and data analysis is there are always subgroups. So the overall, it's been negative. That is, people have had worsened conditions, especially when they were pre-existing, if they were sick before and they were more isolated. But there are also people for whom being a little more isolated, they're more introverted, do better. And they've found, so I think what we're going to find, like the answer to the last question in some ways, is that we have to fit the environments a little bit to the different kind of people. So I think some people have really suffered a lot, and other people have actually done better because this more home has been good for them. But yeah, so that's to be seen.
Mateo asks, how do sleep patterns affect mental health?
Yeah, sleep is probably, I'm writing a book chapter right now for a book on interventions that are behaviorally oriented. And I think sleep is probably, it's definitely bi-directional a relationship. So people who have psychological problems, depression, anxiety, chronic pain will have more difficulty sleeping. But we know that when we manipulate sleep in the lab, we can create psychological problems. So we do kind of know that there's a direction here. So I would argue that it may be the most important variable, behavior that we have. And we don't tend to think of it. Some people can't sleep. Some people choose not to sleep as much because of other priorities. Adolescents in general need more sleep than they did in younger times. So 9-10 hours a night consistently is not uncommon for really healthy sleep. And we also know that there's a kind of sleep when you're in adolescence lessons that helps your brain start to develop not more connections, but it's interesting, it actually prunes away, we think, neural connections that are not necessary. And if you don't get enough sleep, your brain actually isn't developing well. That's why I like the idea of mind, body, and psychology. You change the brain and you change the behavior. You change the behavior, and then the brain, it's very plastic, will come back. So, and I just saw recently a paper that looks like about 450 million years ago, fish were having REM and non-REM sleep. So to spend a third of our life, keep that adaptation for 450 million years means it must be pretty important, or we would have gotten rid of it. We don't tend to keep adaptations for that long.
Jason asks, how do you keep the athletes' responses to your study questions from being biased towards making themselves look better? Do you ask them questions that sort of obscure how you are going to use or evaluate their responses?
Yeah, that's it's, I don't always say everything's a good question, but that's a great question, because it gets to the heart of self-report around the notion of social desirability confound. So people want to respond, even when nobody sees what they're writing. People tend to, even to themselves, want to say. So there are some measures that try to get at social desirability, like how much does the person answering the questions really desire that social approval, and then reducing the scores for those people. But it is one of the, it is actually a difficult confound to overcome. In this case, I ask people, when I work individually with them, I say, just be honest, we're just working on this together. It'll give you data that you can use to improve your performance and focus your mental training. But when they use it for selection, that becomes much harder, because, as you can imagine, like you're suggesting, you asked, can you recover from errors? Well, no, I can't. Okay, well, then we're not going to take you on this NBA team for a $20 million contract, right? So that's not the case. But I do think when psychologists, this is the other thing I can, I guess, mention is, whenever you do have an assessment, a psychological assessment, if any of you ever take them, they need to be interpreted by a professional who can not just use the numbers, but can look at you and see how you respond and see if you're trying to present yourself. We do have some scales that ask people, have they ever done anything wrong? No. If people say 0, never done. Have you ever felt bad about yourself? Ever? Never. Well, then it's leaning towards that, if that makes sense to you. Very good. Great questions.
Cameron asks, how easy is it to enter the zone?
It's not difficult to train the response. The problem comes a little bit like exercise. When I started doing this work, I was so happy that I could really improve people's performance, getting in the zone. It was just like exercise. If you do exercise, you'll be amazed, right? You look up on internet, physical transformations, 93-year-old person does strength training here and does really well. The issue becomes, so I can teach you relaxation response training, how to create positive emotions, how to direct your attention, but you have to practice those. Give you a quick example. I worked with a professional baseball player recently, and he was spending 2 to 3 hours a day just doing the mental training. Well, that was his job. He's a professional pitcher, but he would get up in the morning, he'd do a half an hour of Tai Chi relaxation, then he'd start doing all of his imagery about the event. And when he started, it's just like flicking a light switch, a dimmer switch. When I tell you to turn on the light, you can only turn it on a little bit. But if you practice those things for a few months, you can turn the light on faster and stronger, right? So you actually get self-control. So I can show you that if I looked at your shoulder tension and I said, say the word relax, without any training, your shoulders would be just as tense. But with practicing this for a few months and pairing the word relaxed with the shoulder tension, you'd see the muscle activity go down. So it's very trainable. It just takes more work than most athletes or anyone does. They just say, well, I'll do a little bit of meditation, or I'll try it tomorrow. You really need to, before every practice, use some strategies to get better. Just like lifting weights, you can't go to the gym and watch people lifting weights, think about getting stronger. You actually have to lift the weight. So you have to do the breathing and that stuff.
Um, Carrie asks, do you see old methods such as Hindu, Buddhist, Taoist being slowly incorporated into modern medicine?
Mhm. Yeah, I do. That's when I first started doing this. I was some of your age when I started. When I was 16, I started doing yoga, and it was considered a cult then, right? Nobody self-respecting person would do yoga. I had to go to the Santa Cruz Mountains, so to speak, and with people in saffron robes, and people thought I was going to run off to an ashram in India and leave the West. And now it's seen as a normal practice. It's a physical practice with mental benefits. So I think it's becoming more incorporated. If you're interested to look at the National Institute of Health, that's our big governing body that produces most of the research in the country. There's an alternative and complementary medicine branch of the NIH called NCAMS, and they are doing research on all of these things. So I do think that they're getting anyone who wants anyone who has a capitated system, we call it, which means you have so many patients, they pay so much money, and then all your cost is treating them. Those places were really interested in the prevention that comes from these Eastern practices because they offset the cost. Medicine is very expensive. If you go to the ER, the emergency room, it could cost you $5, $10, $20,000. If you can prevent one of those visits by getting people's mental health better, then that's worth that for them. So I think that's where what's difficult, and I teach these things in my health psychology courses, is kind of disambiguating the language of the East with the West. And so many people are not, we're in California and Sonoma, and it's more open to those things. But many parts of the country, if you mention meditation or Taoism, people would run away as some kind of cult. So I think the movement now is to use those same practices, but not with the language of the East so much. It raises the issue of cultural appropriation because that's where those things came from. So we kind of need to show respect for where they came from.